As I was saying just a minute ago, the doctor would put the syringe over, the assistant would rinse. If for any reason the doctor had to do another injection and they needed another carpule of anesthetic, you would pass the carpule to the doctor and the doctor would change it out. You will not do that usually. Okay? So we're going to wait, let the patient get numb for a few minutes, and then the thing that comes next is going to be rubber dam. Okay? So the assistant, the doctor would be gone, and the assistant would place the rubber dam. And I'll get out of your way. You'll move into the operator position because you don't want to hunch over your chair while you're trying to work, and you're supposed to be higher than the working area in the assistant chair. Again, for this, she is working it around one wing of the clamp, pulling it over the bow, and then over the other wing for the anchor tooth, and then she will pull the other teeth in place. And you can see here she has chosen to have the rubber dam on the frame already. That is an option. Some people will do it off the frame and then put the frame on. So there are several varieties that you will see while you're at rotations. Having a neat work area helps you find items when you've placed them, so keep your work area neat. Notice that she didn't have to spend a lot of time hunting for things. And now she'll go through and floss each contact and pull it through to make sure that all of the rubber dam is down and it's not riding up the tooth like a turtleneck. If it is, she will pull back and use a blunt instrument to help tuck it underneath. And then she will finish placing the dam on the frame. Your doctor is somewhere checking hygiene, in their office, playing on their computer, something. Starting another procedure maybe. But you are good to go and ready for them to come back in and prep. All right. Okay. Okay. So now the assistant is going to be ready to suction. This is going to get loud for this part because we're going to have the handpiece going and the suction going. But just note where she stays with her position. because we have the rubber dam in place, she has her HVE and her air water syringe ready to go. And note where she stays while this is all happening and what she does every time the doctor stops with the handpiece. So anytime the doctor stops, she's doing a power rinse of all the teeth. And if you'll notice, she keeps the tip of the air water syringe facing the preps. She's not just blowing it out here anywhere, but they are actually facing the preps so that she can clean out anything that's inside those preps so the doctor can see better. And then a gentle burst of air, okay? And then this allows the doctor to come in and look to see if there's anything left that they need to finish prepping. And they may go back several times, back and forth, with cutting the restorations or cutting the teeth for the restorations, and then you rinsing and drying. Anytime that handpiece stops, you have to rinse and dry. Okay, so now the teeth are prepped and we are ready to move on to the next step of getting the teeth ready for the restorations. So that's going to involve the assistant moving into the operator position to place any matrix bands if they're needing, and we have an MO on one of our teeth so for a restoration. So we will definitely need a matrix system. We're going to use a Toffelmeyer. You saw how to put that together in a different video. And then she will place wedges as appropriate, and then she will start with priming and bonding. And like we talked about in the earlier video, the diagonal slot is facing the gingiva. She's sliding it around the tooth, using that inner knob to tighten the matrix band around the tooth. You will always place your matrix before you do any bonding agents in case there's any bleeding that occurs. But she's checking the level of her band to make sure that it's where we need it. You can say anything you want to say. And the wedge is placed following the anatomy and the triangle for that embrasure space.
Make sure you're putting it on the side where the wall is missing, okay? This is a MO, so it's going to be placed on the mesial side. Okay, I'm going to do chlorophyll first.
Or do you want to do the phosphoric first since you got to rinse it?
Sure. Okay. So how about for the composite, we'll use the phosphoric etch, and then we'll use the clear fill for the amalgam, okay? Is that good?
Mm-hmm.
Okay.
So this is showing you a different system. You are able to see, I'll come right and get that. With the phosphoric acid etch, you're going to place it into the prep, and we're going to let it sit for about 30 seconds to a minute. And so the assistant would place it, and then you're going to bring your suction directly over the prep, or as close to it as possible, because we don't want to spray that phosphoric acid etch out. And then a gentle dry, okay?
Okay.
And then depending on your bonding agent that you're using, you'll take it and you're going to place it into the prep.
Make sure you're paying attention to you're getting all of the area on the inside. Don't just place it blindly, okay?
And then before you do a gentle burst of air to spread it, always blow out on the patient napkin to make sure we get any water out of the line. And we're just doing a gentle burst of air to spread, okay? That's all it needs. We don't want to desiccate the tooth and have those tubules collapse by over drying.
Okay.
And then because it's composite, we will light cure. Never light cure on amalgam. Okay? All right. And so now that is the bonding taking place for the composite tooth. Now we will go back to traditional clear fill for our amalgam teeth. And so you have your self-etching primer.
And your bond is here, your bond A. Okay, so we're going to start with the primer. Again, make sure you get into the interproximal box, all on the floor, all on the sides. Are we just doing this one amalgam or two?
Yeah, we can do one.
Okay. We're going to let it set for 30 seconds.
We're going to pretend that time has passed, and then we're going to do a gentle burst of air.
Okay, I'm going to wait on the bond until right before we place the amalgam. So I'll put that off to the side. Okay. All right.
All right, so we're going to pause here, and we will start a second video for the actual restorative process.